Kutoka eneo hilo la Bungoma turejee hapa jijini ambapo kwa hivi sasa waziri mpya katika Wizara ya Afya Aden Duale anapokezwa wizara na waziri ambaye alihamishwa katika Wizara ya Ustawi wa Mazingira Deborah Barasa. Hebu tusikilize. Na mtazamaji, hapo kama unavyoona ni Patrick Amoth ambaye ni kaimu mkurugenzi mkuu katika Wizara ya Afya, ambaye kwa hivi sasa anazungumza kwenye hafla ambapo Aden Duale ambaye kwa hivi sasa ndiye waziri wa afya atakuwa anapokezwa zana za uongozi katika wizara hiyo na Deborah Barasa ambaye alikuwa kwenye wizara hiyo kama waziri, lakini kwa hivi sasa amehamishwa hadi katika Wizara ya Ustawi wa Mazingira. Na muona Deborah Barasa anazungumza, tumsikilize.
Incoming Cabinet Secretary for Health and Cabinet colleague, Honorable Aden Duale, Principal Secretaries, DG, Ministry staff, friends from the press, ladies and gentlemen, good morning. It seems as if I have been here for a few weeks, yet I joined this ministry on the 8th of August 2024. Inside those 8 eventful months, I have learned many lessons. In retrospect, I have appreciated afresh that indeed there is no end to illumination, and can say without fear of contradiction that there is a bit to public service that derives its conduct to weigh much more than meets the eye. On a solemn note, today, as I formally hand over the mantle of leadership of the Ministry of Health to my successor and friend, Honorable Aden Duale, I fully appreciate how insight and foresight power human experience and dictate action. First things first, I am truly indebted to His Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, for entrusting me with the privilege to serve our nation as Cabinet Secretary for Health for the time I have. To my dedicated team at the Ministry, Principal Secretaries, Director General, Directors, healthcare workers and all staff, asanteni sana. You were part of my support system, without which I would not have figured out the lay of the land of the Ministry. Ladies and gentlemen, over the past 8 months, we have navigated unprecedented challenges and celebrated transformative milestones at the same time. When I assumed office, our ongoing mission of advancing UHC and ensuring equitable quality healthcare for all Kenyans took on a new turn. We started a journey of transformation that had many moving parts. So far, we have endured the pangs of a crucial teething stretch, particularly in onboarding a new and all-inclusive national health insurance system. The implementation of 4 health laws to support UHC that will operationalize the Social Health Authority, replacing the National Health Insurance Fund, heralds a whole new experience in the Kenyan's healthcare system. Overall, I am glad to report that there has been 163% increase in social health insurance membership, with the current registration standing at 21 million, up from 8 million that had registered with the defunct NHIF. The total collection of the Social Health Authority is currently upwards of 31.6 billion. We have so far settled SHA claims to the tune of 24 billion and a further 21 billion under the Primary Healthcare Fund. This has ensured expanded access to social health insurance, with 13 million additional Kenyans covered. Meanwhile, the gazettement of new SHA packages beneficiary will be entitled to enhanced benefit packages that will cater better for cancer treatment and radically improve ICU payment limits. Community health is the bedrock of preventive healthcare. In recognition of this fact, the Ministry has made strides in achieving the same through training of community health promoters, with over 106 trained staff and over 100,000 equipped with kits for basic medical equipment. We have also enhanced our digital health reach by operationalizing the Digital Health Authority, whose health information exchange system has enabled patient data accessibility in real time across various healthcare providers. This has led to improved decision-making, and reduction of redundancies. Today, all the 47 counties have electronic community health information system coverage. Further, there's improved access to health products and technology, ensuring the success of UHC. We have made it possible for local manufacturers to supply upwards of 60% products to KEMSA. Meanwhile, several initiatives have been implemented to enhance human resource for health. This includes operationalization of the Kenya Health Human Resource Advisory Committee and the activation of the Human Resource for Health policy. Ladies and gentlemen, with the winding up of the Managed Equipment Service Program, the Ministry of Health introduced the National Equipment Service Program that aims to better equip our health facilities across the country. So far, the ministry has signed up 45 countries with 35 requesting to equip over 500 facilities. The ministry has invested in key strategic infrastructure projects, including the Kisii, Mombasa, and Nakuru Cancer Center, alongside the East Africa Center of Excellence in Nephrology and Urology, and right now the rolling out for the Kenya National Public Health Institute. There is construction of 19 level 4 hospitals across the country at various stages of completion. Ladies and gentlemen, during my tenure, the ministry tabled key cabinet memos, one of them focused in upgrading the Jaramogi Oginga Odinga Hospital in Kisumu County to a level 6 healthcare facility. While taking care of long-term progress in our healthcare agenda has been a key preoccupation, we have been vigilant in ensuring that disease outbreaks that could compromise our efforts to keep Kenyans safe are in close check. Such outbreaks are mpox, cholera, Marburg, Ebola from neighboring countries that have had our medical experts on high alert 24/7. Regarding continued funding of our programs in the wake of withdrawal of USAID support, we have considered alternative ways of keeping our healthcare system well-oiled to continue serving our people. The future can only get better. So, welcome to the Health Ministry,
Thank you.
Our brother Aden Duale, and thank you and God bless you.
The Cabinet Secretary for Environment, Climate Change and Forestry, my sister Deborah Barasa, who is the outgoing Minister of Health, Principal Secretary Public Health and Professional Standards, Mary Mudhoni, Principal Secretary Medical Service, Hari Kimtai, holding on until Dr. Oluga is vetted by Parliament and if approves as the nominee of the President, will be our new Principal Secretary for Medical Service, the Director General for Health, Dr. Patrick Amoth, all the staff of the Ministry of Health present here today, members of the Fourth Estate, members of the public, good morning. Ladies and gentlemen, good morning and happy new month. It's a new month and a brand new opportunity to do things differently, to do them better, and to do them bold. Today, 1st April 2025, and my statement is not April's Fool's Day, it's a real statement. It marks exactly 6 months since Taifa Care was launched on 1st of October 2024. A bold step towards universal health care. It remains one of our most consequential programs in our nation's history, driven by the belief that no Kenyan should suffer or die because they cannot afford quality health care. This morning I stand before you, humbled by the honor of being entrusted with the leadership of the Ministry of Health by none other than the President. I do not take this lightly, especially at a time when our health system stands at a critical crossroad. 6 months into the rollout of the Taifa Care, there is a growing scrutiny, and rightfully so. Let me begin with this assurance. The health of the Kenyan people is not negotiable. Every man, every woman, and every child in this country deserves access to world-class health care, which puts the patient at the heart of the system. Affordable, quality, and dignified, regardless of who you are and where you live. This is not a government promise. It is a constitutional right, and it's our moral responsibility. Acknowledging the progress, I wish to commend the tremendous work that has been done by the ministry under the leadership of Dr. Barasa. If I give you the status update, and let me start with the health financing and the social health care, social health insurance coverage. Every year in our country, since independence, Kenyans face severe economic hardship to out-of-pocket payments at the point of care, pushing many into extreme poverty. To address this, the Ministry of Health reformed the National Health Insurance Fund through the establishment of the Social Health Authority that rolled out Taifa Care on October 1st, 2024, with the aim of reducing serious catastrophic health expenditure. Currently, close to 21 million, and to be specific, 20,885,000 Kenyans